All right. Well, welcome back, everybody. Hope you made it back to the session or to the new session okay. I'm so excited to take us to the second session of our day today, and this will be moderated by Cheryl Isabel. So Cheryl Isabel is covering Wisconsin's Milwaukee Community Engagement Lead, as well as a licensed health insurance navigator serving Milwaukee County and Southeast Wisconsin. She's been with our organization for about 2 years. Before coming to Covering Wisconsin, she served as a CAC, or Certified Application Counselor, at Milwaukee Health Services for 5 years. She is passionate in community outreach and relentless in her efforts to assure that health insurance coverage and health equity is accessible for all Wisconsin residents. And I can definitely attest to that. We are so happy to have Cheryl on our team and for moderating this session. And Cheryl, I will hand it over to you now.
Thank you so much, Allison, for that introduction. Good morning and welcome back, everyone, to the second half of today's conference, where we want to share with you a lens into the enrollment assisters world. I'm Cheryl Isabel, covering Wisconsin's Milwaukee Community Engagement Lead and licensed health insurance navigator. This panel session will include 3 expert navigators from various parts of Wisconsin to cover key topics, enrollment trends, and examples of common problems and solutions attendees may see as they start to help people in their community enroll in health insurance coverage. These panels will also bring years of enrollment knowledge, unique perspectives of their local work, and community experience. But before we begin this session, I would like to share with those of you in our audience who may not be familiar with the term navigator as it relates to health insurance and where in Wisconsin to find navigators in your area. The first thing you need to know is that a health insurance navigator is an individual or organization that is trained and able to help consumers, small businesses, and their employees as they look for health coverage options through the marketplace, including completing eligibility and enrollment forms. They also assist consumers with state insurance, with Medicaid, and the enrollment process. These individuals and organizations are required to be unbiased, and their services are free to consumers. Covering Wisconsin has a community of navigators and enrollment assisters across the state that is comprised of its own staff and subcontracting navigator organizations to serve consumers. This map outlines our navigator affiliates and how they can be contacted for assistance. Now, Covering Wisconsin doesn't and can't do this work on its own. We have 45 navigators located throughout the state that are able to help consumers, as well as our partners with questions they may have to help consumers in their areas. This map can be found on the Covering Wisconsin website at www.coveringwi.org when needed. Now, before I introduce our panelists of formidable navigators who will be sharing their knowledge and experience, we will start with our first poll question, just to get a pulse on where we are in the room. If you could bring that poll up. So we'll give it about 30 seconds to see how people respond. So it's looking like so far, most folks in our audience are understand very well the role and responsibilities for our navigators. Somewhat, very little. Thank you so much for sharing that poll. Thank you, everyone that was able to participate in our first poll. And without further ado, I am pleased to introduce today's panelists of navigators. And first we have Colleen Harriman. Good morning, Colleen. Colleen Harriman is the regional lead navigator for the Madison office of Covering Wisconsin. This September marked her 6th year as an enrollment assistant. Colleen is enthusiastic, passionate, compassionate, and very intentional in her service and assistance with consumers, as well as her co-laborers in this work. And the next I present to you, Francisco Guerrero.
Good morning,
Hi,
everyone.
Francisco. How are you today?
I'm very good. Thank you.
Great, great. Francisco was born and raised in Chile, South America, where he obtained his degree in agricultural engineering. He then moved to the United States in April of 2009. Francisco has worked with Covering Wisconsin since 2022, providing health navigation services in central Wisconsin. As the Wisconsin Institute of Public Policy and Service staff, Francisco collaborates with messaging about adult recommended vaccines. He coordinates Hispanic community health work, vaccine outreach, translation of materials, and outreach interpretation at events. When Francisco is not working with WIPPS, he enjoys roasting and brewing cold brew coffee at his business, Redwood Street Roasters in Edgar, Wisconsin. Thank you, Francisco.
Thank you.
And finally, we have Mike Rust. Good morning, Mike.
Good morning.
Mike was a Lutheran pastor and staff member at Lutheran Metropolitan Ministries in Cleveland, Ohio from 1975 to 1988. In 1976, Mike became the founding director of the Northeast Ohio Long-Term Care Ombudsman's Program. He and his family moved to Polk County, Wisconsin in 1988, where he began his work as a family health benefits counselor. Mike continued his work with ABC for Health in 1994 and with ABC Rural Health in 2005, becoming ABCR's Chief Operating Officer. Thank you, Colleen, Mike, and Francisco for sharing your experience and knowledge with our group this morning. Before we begin this question and answer panel, I just want to remind everyone that you can post your questions to the panelists in the Q&A, and our facilitators will keep their eyes out for it. We'll try to take as many questions as we can, but if we don't get to all the answers of your questions, they will be posted on the Covering Wisconsin website conference page, along with our panelist contact once the conference is over. So now we'll begin our Q&A with our panelists. Good morning, everybody.
Mhm.
So these are Milwaukee, I should say Wisconsin's best in enrollment assisters. They are all navigators from different parts of the country. And yeah, we're excited to have them. And we want to thank you all for spending this amazing hour with us with our Q&A. So our first question, our questions are going to be around how our navigators use the referral process and helping consumers and helping one another. And then we're going to touch on some complex cases, you know, and they're going to share their expertise and experience and how, you know, they are able to assist consumers. And then finally, we're going to talk about some policy related issues and just have them share their final thoughts on just this work in general and what they do, how they do it, what they can share with other assisters that are out there in their audience and those that are studying right now to become CACs and assisters. So the first question, I'm going to start with you, Colleen. And that question is, what have you found to be helpful when assisting consumers with eligibility and enrollment benefits access other programs such as caregiving, food insecurity, or prescription drug expenses. Please provide types of referral sources that you use.
Thank you so much. I appreciate that question. I think, as everyone knows who does this work, we come to this work to help others. And to help others, you have to be an active listener. So it is essential to this work. You are listening for pathways to get someone enrolled. You are listening for other needs they may have. And that listening, that active listening, also is what builds the trust for you and the consumer. When I started, I created a simple spreadsheet and started recording resources as I learned about them. During the first year, I relied heavily on 211. For those of you who don't know, that's the United Way helpline, where you can call and get a very helpful person that can help you identify resources in that county, in that region for your consumer if you're not sure where to find that help that's needed. Additionally, the other thing I did was rely on other navigators. When I learned of other resources, I added them to the list and I shared them with others as I learned as well. I think this sounds overly simplistic, but sometimes if I couldn't find what I needed, a Google search sometimes really helped, especially for national programs. And then the other resource I rely on very much is through our own Department of Health and Safety, DHS, because they have very easily searchable links to find clinics for the uninsured or underinsured for dental and medical needs. The other two things I was thinking about is sometimes in your own personal life with friends and family, you learn of other resources because of what they're going through and what they're trying to accomplish. Keep those, put those on that spreadsheet. And then I have just over the years developed connections to local case managers, nurse case managers in the different healthcare provider networks. And just working with them over time, we have sort of a two-way referral going on. And I also strengthen that connection that during the year, if Covering Wisconsin has outreach resources that are useful, I'll reach out to those contacts and I'll share what we have to offer to continue building that relationship. So those are my overview, quick resources.
Indeed, and we do heavily rely on those resources to provide information to the consumers we serve. You mentioned active listening, and it's so important, that we, provide that space for the consumers to be able to explain all of their needs. That way we're capturing, everything that could be a barrier for them. Mm-hmm. And we're able to make it like a closed loop referrals because we know exactly where we need to be pointing those consumers. Francisco, can you share with our audience, some of your types of referrals that you use?
Yeah, and thank you for the question. And also would like to take the opportunity to say that in the case of the Hispanic families, first we need to identify the complexity of the Hispanic families. And what I mean with this is that let's say a family of five, in which mom and dad may be undocumented, then one son born here in the US, maybe another one a DACA recipient, and maybe another one born in their home country. So now you have five individuals with five different needs, and depending on what they qualify for is the kind of resource that we need to kind of focus. So in the case of the referrals, when they need healthcare, here in central Wisconsin, we rely heavily in the WASA Free Clinic because they serve uninsured patients and undocumented patients too. Then we also rely heavy on FQAC clinics because they provide a sliding fee discount for medical and dental. Then when it comes to the case of the food insecurity, we work with different food pantries in the area, but also because with our organization we have community health workers. We work very closely with food pantry in Abbotsford, in which our community health workers they go to the the church, and then they collect a lot of meals, and then after that they're able to go and deliver those meals to the houses of the Hispanic families, because we have to remember that in the case of the Hispanic families, sometimes language barrier can be an issue.
Yes.
Transportation can be an issue because maybe they don't have a driver's license. So we try to facilitate that by um, pretty much by going to their house and delivering the meals through community health workers. When it comes to the prescription drug medications, we explain options for the uninsured patients. One of them, for example, is the 340B program that is available through FQAC clinics. So that way the cost of the medication is a lot less. Was a free clinic here in central Wisconsin provide free medications to the patients. So that also helps the Hispanic families. When it comes to um, dental appointments, FQAC is a big one. But then I was thinking the last thing I wanted to talk is one of the very common referrals we need to provide is eye exams. And for that, we work with another program that is Prevent Blindness, which provide a free exam to families. So in the case of the Hispanic, it's really up to some of their needs. So we're always looking for resources. And just like Colleen said, 211 is one of the options that I use a lot. Find help. .org is another one that I use a lot because there is a lot of program that you can find there nationwide, and it's easy to find it through zip code. But also in our own network with covering Wisconsin, it's always we have an open communication with everybody, and we rely with each other in obtaining some of that information. And in another case is that when none of those work and the patient went for emergency, we help with financial assistance application through hospitals.
Awesome. Thank you. Yes, and indeed, those safety net organizations are really vital in having those referral sources for our consumers and residents of Wisconsin. Mike, based on that same question, share with us your thoughts and referrals that you use in your
Sure,
area.
and I had taken this question to be both referrals and resources that we
Mhm.
frequently use.
Absolutely.
And I've asked Adam Van Spankeren to load into the Q&A the list of a couple of dozen resources and referral sources that I or my colleagues at ABC in Madison use just about every week, and some of them every day. And I see the way it's loaded into the Q&A doesn't make it that easy to sift through it, but we'll try to make sure that there's a better list available as time goes by. And just to kind of buzz through this, the window shopping tool, as we refer to it at healthcare.gov, and healthcare.gov refers to it as C plans and prices, is something that I use just about every day, and I've really tried to weaponize it recently, and I'll get back to that as we proceed. Also, in deference to Ariana and yesterday's moderator, Beyond the Basics, I go to a lot for policy related issues to the marketplace. There's also a link in there to a Q&A page on the basics of tax credits at the IRS. If you go to the IRS website, you can get inundated with way more information than you need, but the link that that I put in the chat is a fairly basic breakdown. Another resource is the Health Connect program of United Way in Dane County that can help people with certain income requirements pay their premiums. And then I also listed both the Badger Care Handbook and the Medicaid Eligibility Handbook. And just briefly, in those handbooks, you can find immigrant charts and know exactly where an immigrant family fits in terms of eligibility. The Badger Care Handbook has a wonderful flow chart that takes a while to get used to that describes who in a household is responsible to whom in terms of financial access to programs. And we use that all the time. On different kinds of income types that are not counted, income types that are sometimes counted, and a lot of times people think that all of their income counts. But there are some specific exceptions that you can find in that handbook. They have great sections on self-employment income, which can sometimes be very confusing for people, plus the change of circumstance issues that may permit you, if you're self-employed, to use your current income rather than your most recently filed tax income to determine your eligibility. There's also sections on health insurance access and coverage requirements to see where a particular child fits in terms of whether or not that child can get Badger excluded because of access to an employer-sponsored plan. They both also have a section on how to use the deductible, where the only reason for someone's ineligibility is that their monthly income is too high. Mm-hmm. So the deductible can be a useful feature for somebody facing big medical expenditures, but their income is too high for Medicaid or Badger Care, and they're outside a special enrollment period for the marketplace. The Medicaid handbook also has sections on sub-programs like the Medicaid purchase plan, which is great for people with disabilities, higher income, higher asset limits. It used to have people very high premiums, but those have been moderated. So the premiums are now much more manageable. Things like Medicare savings plans that can help people with Medicare pay premiums for Part B, etc. Also sections on emergency medical assistance for non-citizens, disability and presumptive disability, which is something you can use to help people get eligible if they're waiting for a formal disability determination. Also shared a link to the Food Share Handbook and the Forward Health Portal Online Handbook. This may not be a benefit, a resource that comes to everyone's mind immediately. It can be a bit thick to work through at first, but it's at the Forward Health Portal main page. You scroll down to the middle towards the bottom and you'll find online handbooks. And there you can find a wealth of information that can help people with disability but have challenges getting access to benefits. It has great sections on every benefit's prior authorization requirements and on coordination of benefits between Medicaid and Medicare and Medicaid and private insurance that can be very helpful. Also a link to the Wisconsin Well Woman program and Well Woman Medicaid for women with breast or cervical cancer issues. Also listed the a map, link to a map that has the Forward Health provider field representatives. These are broken down region by region with one or two people who have responsibilities for different benefit areas, and they can be very helpful with a provider, local drugstore, local hospital, local clinic that is having trouble getting a benefit covered that they think should be covered, but they're struggling with how to do it. The provider field representatives can help them. Also listed, the Wisconsin HMO enrollment specialist number for people who may want to change an HMO to see if they can do it, what it would take to do it, and in association with that, a link to the managed care ombudsman program. I also listed a couple of different links for Health Check and Health Check Other services. For children under age 21 who are on Badger Care or Medicaid, they are not just limited to access for services that are covered in the Wisconsin state plan. Other services, they can get access if it's medically necessary to services that are not covered by the Wisconsin Medicaid program. And we found that to be really helpful. Also, a listing for a link to the ABC for Health and Health Watch Wisconsin have an interactive federal poverty level calculator that is not just a list of or a chart, but it enables you to enter information and it will tell you what a household's federal poverty level is. And it nicely dovetails with the marketplace because you can also enter last year's information and just say you're looking for 2022. ABC for Health also has a of brief videos on topics of interest that I use all the time. And I want to mention just quickly regional centers for children and youth with special health care needs. Now I think they're calling them children's resource centers. We work with, especially we have a contractual relationship with the Western Regional Center, and we find them enormously helpful when there's a household with a child with special health care needs and they're trying to navigate children's waiver services, CCS, some of these very complicated and seemingly overlapping programs. Also, aging and disability resource centers, Disability Rights Wisconsin, and I'll just mention one more for Family Special Need Trust. There's a link to the WISPACT organization.
Yes.
I will.
Thank you so much, Mike. That was a lot of information. And, we need all of that information for referrals and resources in order to do this job effectively across the state. And I just want to mention to everyone that all of these links that in referral sources and resources that Colleen and Francisco and Mike have mentioned will be able to be found in the sessions information section on this platform, and also at the end of the conference when Covering Wisconsin posts its reflection of conference events and topics. You'll be able to find all those resources. All of Enrollment Assisters, CACs, agents, and brokers that are in our audience today. These are some very, very key contacts and referral sources that are very useful. So I encourage you to make sure that you go in and take a look at those resources, jot them down, copy them, and utilize them. And of course, if you have any questions, feel free to reach out to Francisco, Colleen, or Mike, because their contact information will be listed as well for those referral sources that you're looking for. I'll just go quickly, in the essence of time here, into our next session where we want to talk about complex cases, because we know in this work that there's not a one size fits all. You can't put one case in one bucket and it's going to be the answer for different families. Different families have different challenges and barriers and unique situations. So I am going to pose this first question to Colleen. And it is, what are the most effective practices that navigators use to support each other with complex cases? And will you please, for our audience, give us one or two examples of a complex Medicaid, Medicare Plus, or Marketplace case in your experience where a resolution might be of widespread interest to this group?
Okay, I'll do my best. As Francisco mentioned earlier, we're very fortunate. Through Covering Wisconsin, we have a Navigator listserv set up. So if you're having a struggle with a case and you're not quite sure where to go, how to get help, you can send an email that will go to all the other assisters. Obviously, we don't include private information about the people, but we lay out the scenario, and then it is just a great way to draw on all the experience of all the other navigators in different parts of the country, state. And then again, it gets back to relationships. I know many of us have direct contacts at places like DHS, maybe with local consortiums simply from repeated contact. We might even have contacts at the CMS level. So it's really about turning over all those rocks for your consumer, figuring out how to get the information so you can decide what's the next plan, or maybe it may be setting up a plan A, B, and C, depending on eligibility for certain programs. And then a lot of the resources that Mike referenced, using the Badger Care Handbook, the Forward Health Handbook, are great ways to get answers to those complex questions and cases. For me, complex cases for me seem more about the time that they take. That's not a complaint. It's just about working with the information the consumer has, which may not be the whole picture. And then based on that information, figuring out where you go next. So, for instance, a consumer may call you and need some help, and they have SSDI, Social Security Disability. And so in working with that consumer, you kind of need to identify how long have they been receiving the SSDI payments? Because if they have been receiving them for 24 months, then they're eligible for Medicare. Some folks may still be eligible under Medicaid, for instance, the MAP program. So again, it's not so much that it's complex, it's identifying the important components and then taking the next step. And then, of course, if the same person is not eligible for a Medicaid program, then it's working with them to get a marketplace plan until they have hit those 24 months in which they can then move over to Medicare. And then I think the other complex case, again, I don't know if it's so much complex as time consuming sometimes, is now with the unwinding, when we're getting lots of folks calling for help with Medicaid redetermination, reapplication, renewal. We're getting a lot of what we call dual eligible. So folks who are currently eligible for both Medicare and Medicaid, or at least they were when they were first enrolled. So now that several years have gone by, it is about identifying what their income is, what their assets are, and is there another path to allow them to keep their Medicaid? So again, I think it all gets back to being an active listener, identifying the components to that situation, and then making those choices. Thank you.
Thank you, Colleen. Thank you so very much. I'm going to pivot a little bit and just swing over to Francisco. And Francisco, I'm wondering if you could just share with us um, some examples of complex case troubleshooting, including immigration eligibility, mixed family status, that type of thing. Just kind of walk us through some scenarios of the complex immigration cases you may come across.
So when it comes to insurance in the US, you have to be a resident or a citizen to qualify to the Affordable Care Act or Medicaid or Medicare. Unfortunately, we have a large number of Hispanic population that is undocumented. So because of that, now you need to navigate different waters. And in this same group, even they have all the permission to stay here in the country, DACA recipients don't qualify for the Affordable Care Act either. And because of that, we also need to navigate like what resources are available for them. So in most cases, the first interaction of a Hispanic with the healthcare system is through the emergency room. Hispanic patients usually don't go to the doctor if nothing hurts. So when something hurts, they go to the emergency room. So this is a case that I worked a year ago, and this patient goes to the emergency room. She's undocumented, so she doesn't qualify for Medicaid. She doesn't qualify for the Affordable Care Act, and she's not aware of FQACs or free clinics. So she get diagnosed and she spent like 2 months in the hospital. Uh, at that point, because she was in the hospital for so long, the social worker submit disability for her without maybe knowing or without asking if she was undocumented or not, or if she was a resident. So then this patient come to us with a lot of paper and big bills, over $300,000 in medical bills. So the question is, at that point, what do we do, right? So I started reviewing all the paperwork, and the first one I noticed is that they submit a disability for this patient. Well, undocumented immigrants don't qualify for disability. But when that goes into the system, everything kind of slowed down the next step, because my first thought was, okay, she went for the emergency room. Let's apply for Medicaid emergency, which undocumented immigrants or anyone in the country will qualify for. But there is some exceptions there. So she's we submit the paperwork for emergency Medicaid, and we couldn't move that application forward because the disability application was pending. And we needed to wait for that application to resolve before we can even move forward with the Medicaid application for emergency. The people at the consortium was very gracious, and they completely understood the case, and they were very they provided a lot of feedback at that point. But then I learned, because I think a lot of us navigators, we learn by doing. And in the case of the Hispanic, we always finding places to learn more, because we need resources. We need to connect people to the services they need. So during that conversation with the consortium, I learned that she will not qualify for emergency Medicaid because she was single with no kids. And because that exception kind of puts her out of Medicaid for emergency assistance. So then after that, we needed to submit the Medicaid application. We needed to get the denial to move to the next step, which was financial assistance application through the hospital. Because we needed the letter of denial. So we can apply for that to prove that she didn't qualify for insurance. So once we get the denial from disability, the denial for emergency Medicaid, then we took all those letters and we start submitting applications to all the associates of the hospital. And when we did that, then she did qualify for financial assistance, and we were able to reduce that bill to a total of $1,500, $2,000, I think. So when it comes to Hispanic, it's really know how we can address the needs, especially if we know what are their situation. And like Mike and was saying, it's important to know what are the policies for these cases. I didn't know, for example, that in the case of emergency Medicaid, if you didn't have kids in the country, you didn't qualify for. So that was something that I learned by kind of navigating those waters. And then obviously it goes the reading, and then the people at DHS was very, very kind, and they provide all the information I needed to continue with the application process. So Hispanic, I will say probably Hispanic cases are always complex cases because there is never a straight answer. There is never an easy answer. It's always going to be something that we're going to have to navigate and find answers. And I think that's the reason why it's so crucial, the navigator work. I rely heavily on the people around me. I rely heavily on Maciel, Lourdes from Centro Hispano, Mariana, my coworker here, Vanessa Silva. They are like amazing team to be around here in Central Wisconsin. I just want to appreciate and thank all of them when they're willing to support all the questions we have.
Thank you so much, Francisco. And that just goes to show and outline to, all the enrollment assisters, certified application counselors out there, that when you do encounter, these complex cases, as we call them, but they're just more timely, consumable cases where we need to spend extra time, that it's never going to be a one size fits all for an entire group of people, and certainly not a one call that's all. You're always going to be going back and forth and taking the time to assure the consumer to know that they're not alone. They don't have to do this alone, that they have support of enrollment assisters. And since you mentioned policy, I'm just going to let's just dive into some policy related questions here. And so my question to you guys is, and feel free, whomever wants to jump in first, is what are some policy practice issues that have presented the biggest challenges for families, individuals? And how does a navigator gain resource on how to stay on top of policy changes and process improvements? Can you guys share that with us? Mike, I see you're eager to go. Go on, jump in on us.
So one of the ways that I try to stay on top of things is that we have at ABC for Health twice daily, we call them stand-ups, and at those stand-ups, our staff present every new case that's come in, and we just talk about it, and we get all the wisdom of the group to discuss that. We also have a sometimes 2.5 hour case meeting on Wednesday mornings. And so those are opportunities for us to be able to stay up with a lot of policy issues. One of the things that I've discovered is that some policies that don't look like they should be very challenging turn out to be very difficult, like children getting access to over-the-counter medications, and even though they have a prescription, they should be able to get coverage through Health Check Other Services. We've found that policy looks great on paper, but it presents some real challenges when you try to actually make it work through a pharmacy. Same thing with residential treatment. Federal Medicaid requires that states cover residential treatment for adolescents, I'll say. It's not, though, part of Wisconsin's Medicaid plan. We've actually done an appeal in the past and had it approved, but that has not proven to be a very useful pathway for a typical family facing the need to help a child go into residential treatment. So that's a policy issue that I think we still struggle with a lot in Wisconsin. state is actually required to provide that coverage. And even if we don't have any accredited certified PRTF, psychological residential treatment facilities in Wisconsin, the state can be asked to provide that care in another state. In addition to that, we did have there's that we were able to find something pretty useful from. Typically, if you're an inmate in a jail, you cannot continue to get your benefits covered by Medicaid or Badger Care. However, I discovered a few years ago, and then worked with the assistance of a jail nurse, Donna Peterson in Polk County, and with Donna Johnson in Polk County, and Diana Peterson at Economic Support, that we were able to, if you were a new inmate and you had medical costs and you were on Medicaid or Badger Care and you had medical costs in the first month of confinement, those could be paid for by your Medicaid or Badger Care HMO. So it turned out to be, turning a challenge into a real benefit. Also do a lot of work with families that have medical debt. And we've included medical debt as part of our intake interview. And we've got an attorney, Tim Hennigan, who is kind of specialized in working in this area. And nonprofit hospitals are required to provide patient financial assistance before they take extraordinary collection actions. So we've been able to assist a lot of people with medical debt to, first of all, ascertain if they were offered the right resources. And the law requires that a facility provide you up to 240 days after the date of the first billing statement, for you to apply for patient financial assistance. So that another policy issue that has presented challenges for families in Wisconsin, for single mothers in particular, is Wisconsin's birth cost recovery policy. We're one of only a half a dozen states that still continues to pursue birth costs, and we collect about as much in birth costs as any state. And one of the things that I'll be providing is a link to the page at the Department of Children and Families that specifies the current rules that govern how much can be recovered and from whom. So those are some policy challenges where we can turn what's a challenge into a benefit, some of them not yet completed.
Colleen, Francisco, either one of you want to jump in and share your thoughts on that?
Sure, I can. I call these next three unintended consequences, where regulations, federal and state regulations, kind of intersect in an unhelpful way to the consumer. So I'm just going to give kind of a high overview. The first one is in regard, once again, to SSDI. So some folks, once they apply for Social Security disability, if they are approved and their approval date is backdated, they often receive a lump sum of disability payments, sometimes covering several tax years. If that consumer is currently on healthcare.gov and receiving tax credits without the assistance of a tax preparer, that lump sum could cost them money at tax time. So that's a fairly straightforward one right now. We are referring folks to whom this happens to find a tax preparer. I have not kept up on the tax law. My understanding is the normal route is to amend previous year tax returns. So that's one. The second one has to do with coordination of benefits between a marketplace plan and well, the presumption that the consumer has Medicaid or Medicare. So in short, we'll have a consumer who's 65 or older, and for one reason or another, they are not eligible for Medicare or Medicare premium-free Part A, meaning Medicare would be too expensive for them. This often impacts either US citizens who just didn't have enough work quarters, didn't have a spouse to help them get Medicare, or a newer US resident or citizen whose work life occurred out of the country. And what's happening is they enroll in a marketplace plan, and then the insurance companies, I'm just going to say it's a programming thing, they're flagging consumers who are 65 and older. The benefits then get paid as if the consumer, simply by virtue of being 65, must have Medicare. So meaning they're only paying a portion of that bill. And so a lot of people come to us confused if that's happened. And depending on the insurance company's policies, sometimes the consumer is asked to get proof from Social Security Administration that they are not eligible for Medicare. And I think that's hard enough for someone for whom English is their first language, but throw in other complications like English as a second language and dealing with such a huge organization that again adds time and a layer of complexity and stress to the consumer. They've got medical bills piling up, and once the insurance company is aware, it's usually a pretty quick resolution. But the trick is how much time has elapsed between the time the consumer starts having these bills come up and hopefully they've reached out to us. So that's the second one. And then the third one is also kind of a weird little niche one. Essentially, it's low-income consumers who are not eligible for Medicaid or healthcare.gov. So this could impact, again, older consumers for who came here as adults, and they don't have any taxable income, but they have assets, and those assets are too high to qualify them for Medicaid. But that lack of taxable income, you know what? I'm sorry. I'm going to start again because I don't want to get this wrong. So this impacts older consumers who are U.S. citizens, naturalized or born here, what have you, who are not eligible for Medicare. They have zero taxable income, but with assets too high for Medicaid. So they're left with a choice to pay for a full price healthcare.gov plan, which is often for them not affordable. And then use FQHCs, clinics, free clinics for the underinsured or uninsured. And then the only path to coverage is spending their life savings so that they do eventually become eligible for Medicaid. So these are three where I feel like the federal regulations and the state regulations create this unintended, often painful, expensive consequence for the consumers.
Yes. Thank you for sharing that, Colleen. And it happens quite often, unfortunately. It happens. Francisco, can you please just chime in and share with us?
Yeah, for policy, to me, it's almost like it's a call to action, and it happened at a different level. It happened at the local level, county, federal government, local government. In some cases, maybe we have the opportunity to provide some input. In some others, we are not. We are fortunate that we get the opportunity to sit at the table at the local level, and then we can bring up some of the issues that are affecting the Hispanic community. Some of the policies that affect the Hispanic families. I'm going to talk again about the undocumented immigrant. For example, if you are undocumented but you are pregnant, then you qualify for Medicaid, and that is going to cover the baby, it's going to cover the mom. But once baby is born, then the insurance expires for the mom. But then the question is like, so what about if the mom is looking for some sort of birth control? So in a lot of cases, we have to be aware of what are options for some reproductive healthcare. So that way the moms can get access to that, and then can have the opportunity to plan their family. So we work very closely with Health First here in central Wisconsin. They have about 7 to 8 clinics in the state. And when we identify that the mom is losing health insurance, we try to connect them to them so they can apply for reproductive care. The other policy that I think is it's always like you're gonna get your hopes high and then they come down is the DACA, because they don't qualify for the Affordable Care Act. We all were expecting that they will like do now, but yesterday they rule again that DACA is not lawful. So now they're fighting it again. So now it become uncertain if they're going to be able, if the government is going to be able to introduce them so the DACAs can access insurance through the Affordable Care Act or not. So now everything becomes uncertain. So those are two ones that I can think on top of my head that really affect the families, and then everything kind of scale down to other programs and other social programs that can benefit the family, but because of documented issues for being undocumented, sometimes affect them directly.
Well, thank you. Thank you all for weighing in on that. And I know we're all hoping that in October, at least before open enrollment, that the decision on DACA is confirmed and finalized, and that we'll hear good news about that. So I do thank you for sharing that wealth of information from you all on some policy and practices and things, sharing different experiences that you've had with policy related issues. And I do want to remind everybody that if you have questions, please put them in the chat. We're going to get to as many as we can. Our navigators on this panelist have shared so much information with us, and we don't want to miss any key topics that you would like for them to answer for you. So please direct your questions to the panelists in the chat. And we're going to just switch gears here a little bit and talk about what we know. We all know what's going on right now, and that is the Medicaid unwind. And if you could just each share with me just a few minutes, what kinds of things are each of you seeing now when you're helping consumers through this Medicaid renewal process? Mike, you want to start with us?
Sure. So one of the things that I'm most concerned about are parents who assume that they're not eligible because their income and they just know they're not eligible anymore, and so they don't bother to reapply, at least for themselves, and thereby they forsake the earned income extension that could give them an extra year of coverage. So that's just something that really concerns me. Another thing that I've seen is a couple of individuals that have had real troubles because they have child support enforcement sanctions, and those, you talk about complex eligibility cases, trying to unwind with a mother how to resolve a child support cooperation sanction against Badger Care Medicaid eligibility for her, should not extend to the children, can be really complex. And I've seen a couple of those. I've also seen a couple of parents whose, and these are Badger Care, whose renewal date has not been extended to match their child's renewal date. That's fixable, but it can be a challenge. I've also encountered 3 clients, never encountered this before, who did not know that they were on Medicare. I was surprised. I've also encountered more fraud than I've ever encountered before. And the fraud that I've been seeing involves people who've actually gotten, the fraud agent actually gets them a marketplace plan, a legitimate marketplace plan. But there's a twist. They charge a $240 some dollar and then a continuing enrollment fee of, I think, $116 a month. In another case, the individual who was the victim of the fraud, again, got a legitimate marketplace plan, but it did not cover any of the special health care needs that this person had. So we had to redo that plan. And in this case, the agent not only got the person a marketplace plan, $744 premium, $744 APTC, so no premium, but also sold them a short-term health plan for a couple of $100 a month that they didn't need at all. So those are a couple of things that we've been seeing. Also had one case where this was something that hadn't happened before, but a consortium agent from Great Rivers knew that a client I was calling with was confused about her notice, and the consortium agent asked the consumer to get their notice and walked her through it page by page. It was a great interaction. So that was very, very helpful. One other thing that I've been finding really useful, I mentioned earlier, weaponizing the window shopping tool. I try as much as I can to have 2 appointments with people, sometimes 3. The initial appointment where I get all of their information and load it into our advocate case platform, but then I will send them, if they have access to the internet, a link to the window shopping tool, then make an appointment so I can walk through the window shopping tool with them. Instead of just having them do it as homework, I make an appointment, walk through it with them, and then they are much better prepared when we have an eventual application appointment to pick a plan, which is often the most difficult part of an application. So I'll stop with that.
Okay. Colleen, if you could quickly, we've got a few minutes here before we have to go to our next poll question, or our final poll question, and then see if we can get through some of the Q&A.
Okay. In short, I have not had that level of complexity in a lot of my calls about the renewals for Medicaid. I do have a lot of folks who didn't realize they still had Medicaid Badger Care. They just presumed that once they got a job or their income went up, that it just ended somehow. I have had a few people who didn't realize they had Medicare. They just got this red, white, and blue card, and they didn't really know what it was. It does seem that with the folks needing help doing the renewals, there are varying levels of not only health insurance literacy, but also actual knowledge of what they currently have. So they may not realize that Medicaid and Badger Care are indeed the same thing. And then they get confused because the card says Forward Health. So again, not so much complex as time consuming. Getting calls again from dual eligibles. So just taking those extra steps to make sure there isn't another path for them to keep their Medicaid if it's looking like they're ineligible. And then really quickly, I've had several consumers who have young adults in the home with a disability. The parent is caring for the young adult and getting paid through a long-term care waiver program like IRIS. I know the state has done their best to hire new workers to handle the volume of calls right now. Some of the new workers, they just haven't had a chance to encounter all these situations. So I've had numerous people come to me in this situation being denied for Badger care when actually they're eligible, because in that situation, they met the requirements to disregard that income. So again, it's been helpful. I'm learning more as I do, like Francisco said, but yeah, it's just a different experience. Thank you.
Thank you, Francisco.
Yeah, in the case of the Hispanic families, it really depends on their immigration status. We have to remember that a lot of immigrants do qualify for health insurance through the Affordable Care Act or Medicaid if they are permanent residents, if they are a victim of domestic abuse or human trafficking. All those visas qualify for permanent residents. Work visas all qualify for health insurance assistance. So with those, it's really, like Colleen was saying, dedicate the time to see, okay, which is the next one. Would you qualify for employer-based insurance, or now is the time to move into the ACA? In the case of undocumented immigrants, what we're seeing, for example, all the people that during the pandemic qualify for Medicaid for emergency or for pregnancy, and they are undocumented, they are losing their coverage at this point. So, but because they're losing the coverage, that doesn't mean that there is not other assistance. And it really gave us the opportunity to talk about FQAC and how they work and that they operate, connect them to free clinics also. Ideally, trying to find what really works for the family, help them understand the importance of primary care for the family is also huge. So even though they're losing the coverage, but at the same time, it gives us the opportunity to provide a lot of education to the community. That way, they can identify health conditions sooner than later. And that's something that we're working very closely with the Hispanic community.
Thank you. Thank you all so very much. And that, folk, was an example of the navigator's work and experience. And thank you for spending this time with us and walking us through that lens into the enrollment sister world. So at this point, what we're going to do is we're going to bring up that second poll question very quickly, and then we're going to go into some Q&A before we close it out. So if we could pull that poll question up, number 2, there you have it. So this is for the group here now that you have walked through all these experiences and heard a lot about what the navigator is. Which of the following is not a key characteristic or responsibility of a licensed health insurance navigator? So we'll give that a few seconds. Oh, wow, we're weighing in very quickly here. It's a lot of smart cookies out there. Yeah. So yeah, we are at 97% of the audience says that navigators don't make recommendations to consumers on the plans to select to meet their needs. Thank you, everybody, for participating in that last poll. So now, if we have questions for our navigator panelists, our panelists of experts, and we thank you for all this wealth of information. I mean, I've learned so much today, from you guys, and I know that the entire room has. So if we have any questions, I'm not able to see them. So if you can pull them up, that would be great.
And Cheryl, we do have a few questions from the audience. The first one that I see is a question: what is the best way to prepare someone for APTC reconciliation when helping them enroll in a plan? Are they automatically provided with the correct forms at tax time, or do they need to request the forms on their own?
Jump in, anybody.
I would recommend the Covering Wisconsin Health Insurance Literacy materials on premium tax credits. There's two. I don't know if someone could put in the chat maybe the link to our Learn section on our webpage. In theory, people should be receiving their 1095A, their premium tax credit forms, around the same time that you'd normally get a W-2. So end of January, early February. However, sometimes that doesn't happen. So I have, sometimes I will have to call the marketplace call center with the consumer, and you can print out blank 1095A forms from the IRS website and fill in those numbers for them. They can call and request the 1095A, and they should be forewarned that they may get multiple 1095As to reflect any changes that were reported on their application during the year.
Yeah, and then we might have we have time for one more question here. The question is, I've had consumers not reporting Medicaid coverage or employer insurance offer to Marketplace for months, despite advising them to contact me with their changes. We can terminate coverage on healthcare.gov, but is there a way to do an escalation on healthcare.gov? Let's see. Calling, sorry, trying to scroll down and see. Calling the marketplace is the only way.
Unless someone else wants to answer, I could. So just to make sure I understand the question, it sounds like the concern is that you're trying to get a retroactive termination to the marketplace coverage, which they will not do. However, my understanding in talking to folks who do tax preparation is that there really is no mechanism on the federal tax return to identify that the consumer had the dual coverage. So in theory, that person could be audited and the dual coverage could be discovered. So it's sort of a let sleeping dogs lie. I mean, I always try to tell consumers, worst case scenario, if you get audited and they discover, you will be asked to repay this assistance. I mean, I think it's worth trying to appeal and to get a retroactive termination from the marketplace, but I've done it a number of times and they won't offer it. So maybe if Francisco or Mike have other pathways, I would love it if they would jump in.
Yeah, usually the phone call is the only way to escalate it or to take an action compared to the website. But at the same time, if the consumer I will have the conversation with the consumer explaining that if he doesn't report those changes, he will have to pay back the tax credit that was applied to his insurance.
One of the helpful for families in this situation is there is a reference tool that indicates how much of your tax credit you might have to pay back.
Yeah.
And it can be, if your income is relatively low, the amount you might have to pay back, the amount you're at risk for paying back can be quite manageable. Well, sorry, that's a false. It might not be manageable for everybody.
Right.
But it's not that high.
That's a good point.
It's not thousands and thousands and thousands of dollars. So it depends on your income, and I think it's helpful to keep that tool handy so that you can tell people who are panicked about what they're actually at risk of. Colleen mentioned in this circumstance she's not had great deals in the marketplace. And I can't gainsay that about this circumstance. I just want to mention, in case it's useful, I found the marketplace appeal system to be very, very effective. I know it can be intimidating. I mean, you're filing an appeal with this federal program, but I've had very good success with filing appeals, and they have gotten easier to file. So I would certainly recommend, don't just walk away from filing an appeal.
Yeah, it's very straightforward. It's an easy process. I echo what Mike said. It's just retroactive terminations. Maybe they'll change it, but right now it seems to be a no-go.
Right.
Well, thank you guys so much for all of your expertise and everything that was discussed today. And thank you, audience, for spending this amazing past hour with us. On behalf of Covering Wisconsin, we're so appreciative of each of you, Colleen, Mike, and Francisco, for providing a lens into the enrollment assistor world. I'll hand it off to you, Allison Espeseth, to close us out for this Friday session. Thank you, everyone, for joining us.
Awesome. Wonderful. Thank you so much. That was such a wealth of information. And I know we could have continued on with so much more knowledge of this team. And I know so many of you out there also could have also shared your own knowledge, and perhaps we'll continue this kind of same panel in future years. And really great comments and questions in the Q&A. Many just kudos for this group and their information. A few clarifications, including one that people with many immigrant statuses can qualify for healthcare.gov insurance with financial assistance. So there's more information. We will be posting those resources. If you found some of them already in the session information, but we'll also be sharing them on the conference webpage with this session once in the coming days. It will be there. Well, thank you. That wraps up our Friday sessions, and we will see you all again on Monday at 9 a.m. and have a lovely weekend. Thank you so much.